Betty doesn't feel well today. There's a school nurse in Betty's school. The teacher thinks that Betty should go and see the nurse. The nurse looks at Betty very carefully. She sees some red spots. Could it be the measles? The nurse thinks, so she arranges to send Betty home right away. Dr. Fuller comes to see Betty at home, and sure enough, he says that she does have the measles. Dr. Fuller explains to Betty that she will have to stay in bed until she gets well. The doctor makes out a report saying that Betty has the measles. He will send this report to the Department of Health. Dr. McNally is the health officer in Betty's town. He is in charge of the Department of Health. His staff collects reports of all diseases which can be spread from one person to another. These diseases are called contagious. The health officer wants everyone with a contagious disease to be in isolation. Isolation means that the sick person will not be allowed to go where she might spread her disease to anyone else. Dr. McNally and the other men and women at the Department of Health work closely with the family doctors in Betty's town to find and isolate cases of disease. But more important, they fight to stop disease before it can start. One way they do this is by making sure that everyone gets vaccinated. A vaccination can protect you from a disease. Something like a heavy coat protects you from the cold. The Department of Health laboratory in Betty's town plays a very important part in the fight against disease. Here, tests are made and studied. Each dark spot is a colony of germs. If nothing is done to stop the spread of germs, they can make thousands of people sick. The Department of Health fights in many ways to keep germs from spreading through the town. The milk you drink must be fresh and free from harmful germs. At the local dairies, inspectors from the Department of Health take samples of milk. These samples are tested in the laboratory to make sure that they are free from germs which might be dangerous to you. How about water? After all, everyone drinks water. Well then, isn't it important for that water to be safe and good to drink? It certainly is. Technicians at the Department of Health test many samples of water every day to make sure that they are pure and free from germs. This careful testing protects you every time you take a drink of water. How do you know that food in restaurants is good and safe to eat? Health inspectors carefully examine all the restaurants in town. They make certain that food is prepared and served here with the same care and cleanliness as it would be in your kitchen at home. You can be certain that a restaurant inspected by the Department of Health is a safe place to eat. Here is another way that disease germs can be spread. Millions of germs can live and grow in waste like this. When people are careless with waste, it's easy for disease to spread. The Department of Health fights this kind of carelessness and teaches care like this. Making certain that garbage and other waste materials are disposed of properly is an important way in which the Department of Health fights germs and disease. Protecting the health of an entire town requires the work of many people. Volunteer workers in your town may arrange meetings where parents with young children can talk with the town doctors. Here, a mother can see how her child is growing and learn the best ways to keep him healthy. If you are handicapped, you might find that your town has special classes for handicapped children. The town may arrange for chest x-rays, which can detect diseases whose symptoms are hidden to view. The x-ray takes only a few seconds, but it can help to discover certain diseases in their early stages when they are easier to cure. Your town may also provide visiting nurses who go out to homes where people need care for injuries or illness. This is routine. When an emergency strikes, the Department of Health is ready for it. A case of typhoid fever, an uncommon and dangerous disease, is reported. Soon, another case of the same disease is discovered. The next day, a third case is reported. If this disease is not stopped quickly, it can spread through the town, causing suffering and death. Homes where the disease has broken out are put under quarantine. When a house is under quarantine, only doctors and nurses are allowed to go in and out. Three cases of typhoid fever. The Department of Health must find out how the disease is spreading and stop the spread. Like detectives searching for clues, they ask questions. Where does your husband work? What restaurants does he eat in? Has there been any trouble with the plumbing in your home? Where do you buy your groceries? Do you know either of the other two sick people? Do you go swimming in a pool? Samples of water are taken from the homes of the sick people. The samples are tested to see if sewage has gotten into the water. More tests are made. And more questions are asked. Do you work out in a gym? Do you have any friends who live on Oak Street? Have you taken a drink from a stream? The answers to hundreds of questions and tests are put together and compared. And finally, 3 answers are found that match. All 3 of the sick people ate in the same restaurant the week before they became ill. The men and women who work at the restaurant are given complete physical examinations and are thoroughly questioned. The restaurant itself is inspected to the last detail. Questions and tests. And finally, the answer is found. This man recently quit working as a dishwasher in the restaurant. The results of a thorough examination show that he carries the germs of the disease in his body, even though he isn't sick himself. The germs traveled from his body to his hands, and from them to the dishes he washed. Now that the person who carries the germs has been discovered, he can be treated. And the spread of the disease is stopped. Betty is feeling much better. Dr. Fuller examines her and finds that she no longer has the measles. The doctor writes a note to Betty's teacher saying that Betty is cured of the measles and that she can go back to school. What can you do to help fight the spread of disease in your town? First, keep yourself healthy. Follow all the rules of good health. Second, don't be careless. Be careful about germs. Third, help keep your house and your town clean. Don't let germs breed where you live. And finally, when you are sick, stay at home in bed. You'll get well more quickly, and you won't spread your germs to others. In Betty's town and yours, there are fighters, men and women who fight to keep your town a safe and happy place to live. There are the policemen who fight crime and protect you in traffic. And there are the firemen who ride the engines to fight fires. But she is a fighter too. And so is he. And so is she. All the people in the Department of Health are fighters too. Fighters against disease and death. In the fight to keep your town a happy and a healthy place to live.